Good evening, guys. This is C. This is D for you, or C for you. Um, the article explores how missed collaborative opportunities between caregivers and medical professionals during end-of-life care. Okay, so we're going to discuss that for tonight's C. So please join me in tonight's C presentation, end-of-life care missed opportunities for collaboration. Okay, all right, so we'll start now. The article explores how missed collaborative opportunities between caregivers and medical professionals during end-of-life care can lead to unintended burdens. Bereavement, especially for family caregivers, often brings psychological distress, including regret and self-blame, while healthcare professionals provide emotional and medical support. Little attention has been given to how they can effectively collaborate with family members to make the process smoother. Okay, to address the gap, researchers from the Institute of Science Tokyo conducted interviews with individuals who had experienced bereavement, as well as doctors, nurses involved in end-of-life care there. Hold on. I have to change paper. Give me 1 second, guys. Their findings highlight coordination challenges that hinder effective collaboration, leading to unintended protocoled work, or UPW. UPW manifests in 3 ways: overload work due to caregiving responsibilities, overloaded work during near-death stage, and abandoned caregivers who lack support from medical professionals and family members. Caregivers and healthcare professionals can improve collaboration in end-of-life care by focusing on communication, shared decision-making, and emotional support. Here are some key strategies. Okay, open and transparent communication. Regular discussions between caregivers and medical professionals can help clarify expectations, reduce misunderstandings. Okay, hold on. And ensure that all parties are aligned in providing care. Shared decision making involving caregivers in medical decisions fosters a sense of agency and ensures that the patient's wishes are respected. Healthcare professionals should provide clear guidance while considering the emotional and practical concerns of caregivers. Okay, recognizing unintended protocol work, or UPW, Studies highlighted that caregivers often experience overloaded work, and abandoned responsibilities due to gaps in collaboration. Addressing these issues can prevent burnout and improve overall caregiving experience. Okay, the second, guys, I lost a piece of paper. Okay, emotional and psychological support. Bereaved families, bereaved family members often struggle with regret and self blame. Healthcare professionals can offer counseling, grief support, and reassurances to help caregivers navigate the emotional challenges of end of life care. Technology and support systems, digital tools, caregiver caregiver education programs, and structured support networks can help bridge the gaps in collaboration and provide caregivers with the resources they need. By reframing end of life care as, as a continuous process rather than a series of isolated decisions, caregivers and healthcare professionals can work together more effectively to provide compassionate and well coordinated care. Okay, these are several tools that can enhance collaboration between caregiver and healthcare professionals, making end of life care more seamless and supportive. Here are some key ones. Okay, telehealth platforms, services like Teledoc Health or Delta Path Health or telehealth allow caregivers and medical professionals to communicate remotely, ensuring timely consultations and reducing unnecessary hospital visits. Okay, secure, secure messaging apps, tools like push to talk devices and encyclopedia messages platforms enable real-time communication, helping caregivers and healthcare teams coordinate care effectively. Patient portals and mobile apps. These platforms give caregivers access to medical records, appointment scheduling, and direct communication with healthcare providers, improving responsiveness and transparency. Okay, interdisciplinary team meetings. Digital collaboration platforms facilitate virtual meetings between doctors, nurses, and caregivers, ensuring that everyone involved in patient's care is, uh, is aligned with each other. folks, if you have the care team set up like that, it works very well. But you have to be, even patients can be involved in this process about setting up remote care for themselves. They can have meetings with their doctor when they're still alive and things, set up what they want for services when it comes to end of life care also. So I'll just throw that one in for you. Okay. Structured communication frameworks, evidence-based approaches such as those outlined in critical conversations, and the coaching habits, helping caregivers and healthcare professionals navigate difficult discussions and improve collaboration. Okay, here's the question for y'all. And remember what I said about questions. When I get answers is as to what I do for shows. So here's the question. Would you like recommendations on how to implement these tools effectively? Okay, these tools can significantly improve collaboration between caregivers and professionals, guys. And what also helps is if you're adding a doctor, and they you have if you have if they have the access to your information easier, that makes collaboration a lot easier too. Let's see, healthcare professionals, but they also come with challenges. Here is a breakdown. Advantages: improved communication, telehealth platforms and secure messaging apps enable real-time discussion, reducing delays in decision making. Okay, advanced coordination, patient portals, and interdisciplinary team meetings ensure that all stakeholders are aligned, leading to better care outcomes. Increased accessibility, remote consultations allow caregivers to seek medical advice without unnecessary travel, making healthcare more accessible. Emotional support, structured communication frameworks help caregivers and healthcare professionals communicate better. It helps. Okay, give me 1 second. Change paper. Navigate difficult conversations and receive guidance from professionals easier with remote communication. Okay, effectiveness in care delivery. Digital tools streamline workflows, reducing administrative burdens, allowing healthcare providers to focus on patient care. Okay, then we go into disadvantages. Disadvantages. Okay, technical barriers. Some caregivers may struggle with using digital tools, leading to frustration and potential miscommunication. Privacy concerns. Secure messaging and patient portals require strict data protection measures to prevent unauthorized access. Okay. Cost of implementation. Okay. Implementing and maintaining these tools can be expensive, especially for smaller healthcare facilities. Last one. Okay, over reliance on technology. While digital tools improve efficiency, they should not replace human interaction, which is crucial for end of life care. Okay, potential for uh, misinterpretation. Written communication lacks tone and context, which can lead to misunderstandings between caregivers and healthcare professionals. Would you like recommendations on how to overcome these challenges? Okay, folks, so that is it for tonight. Um, I will be back on late tomorrow for shows. Um, late tomorrow. So for now, Gator Wellness, take care, folks. I see everybody for shows tomorrow. Have a good night, folks.